Okay. I just ate a bunch of chocolate and I'm gonna go off on a little bit of a rant here. Because I'm feeling good. One of the things that I've been really distraught by lately is the fact that I don't know if I'm being a good doctor or a doctor in training. I feel like there's a bit of a disconnect in what my patients want to achieve and what they're actually doing. And despite all the health information and the education that I share or that they can find out there in their lives, the ability to make actual change or take action to promote their health is lacking, I find. And I'm getting a bit frustrated as to why people aren't taking responsibility or control for their health. And it's not their fault. I think we as doctors have a huge role that we can play here to support them. I'm gonna start by sharing my story really briefly with you guys. I grew up really closely with my Grandpa Joe, and he had a farm and we would play in his farm growing up as kids, and we would see him working hard in the fields all the time. He would proudly come up to us and share his inventions, usually some kind of handmade tool that he built in his shed, and he was just so productive and so alive. And as we grew up, he would take us for dim sum, which is probably his favorite thing to eat in the world. Yeah. And he would take us swimming, to trips to Hawaii or on cruises, and we just hang out and have a lot of fun with Grandpa. And as I became a young adult, Grandpa started slowing down, so we did more relaxing things together. We talked a lot in his backyard and spent so many afternoons together just sharing stories, and I listened to him. I learned a lot, and like a lot of knowledge, but I think his greatest gift to me was learning how to love someone unconditionally for all their roles and for all their actions. Because Grandpa was a childhood war survivor. He was a son, a husband, a father, a grandfather, a prankster, a proud man, a moody man, a man who loved dim sum. He's a complicated man, and over time he also became a sick man. And I watched my grandpa grow sick and become helpless and shift from that identity of being a productive and brilliantly giving man into a helpless victim of his diseases. And it was confusing and devastating for me to see someone I love so much who seemed unable to get back to the life that I know they could live and the person that I know they were inside, because he started becoming his disease that was slowly taking over or overshadowing his identity. So I seriously started my pursuit to become a doctor because I wanted to help Grandpa become well. I wanted him to become Grandpa Joe again. But I came to realize rather harshly that I can't fix people. I can't just give them information about health and expect them to change or make real change in their life. It wasn't working. I was telling people what they should do and providing recommendations, health information, all the resources that I've been learning in school to help them. But at the end of the day, the information would sit there and they would still be sick. So what was I doing wrong? And I realized that there was no incentive or there was no meaning no meaning driving the change. So I decided to reframe the way I was practicing in clinic and started asking people why they wanted health on their side. Big humbling lesson for me was that it wasn't about me and the health information I could provide. It was about them or you and your purpose for health. So I actually did this with a patient, my first patient I tried. I asked them why they wanted to quit smoking, because we've gone through all the, why you should stop smoking from a medical perspective. And their response was not medical at all. It was personal. They told me after giving it some thought that they never wanted to see their child smoke. And at our next appointment, they came back and told me they completely quit. And you notice that their answer wasn't generic. It wasn't to be healthier, to be more energetic, to live longer necessarily. It was something that was stronger than that. They found a basis for a health-promoting behavior. Now listen to this. They found a basis for their health-promoting behavior on something that they could resonate with. And that something was meaningful, much more meaningful to them than weak statements like, I want to be healthy, I want more energy, I want to look better. Those don't carry enough weight. So my big takeaway here is that we need to start reframing the way we practice to help really promote health from a place that resonates with our patients. So this is my call to action for my loved ones, for my colleagues, my classmates, and for other healthcare providers. We need to start making health promotion a real thing. It's been hypothetical for so long. Yeah, when they can really feel a strong pull to start taking action towards health, we realize quickly that health is not their end goal. And, that may be kind of counter to what we're learning or why we're in medicine. But if you step back, we're in medicine to give people their lives back. We don't live to be healthy. We live to fulfill our purpose. So, giving substance to health-promoting behavior is what's gonna, I think, make a big change. So that's the change I want to see. That's my why. I see a gap here, and I want us to start taking steps to fill it, to figure out where we can be the most effective, and if we can start working together now, I think we can start shifting the way medicine is being practiced and make it even more effective for the people that we love. Thanks, and I'll see you guys soon.